My name is Dr. David Harrison. I'm the Associate Medical Director for the U.S. Division of Best Doctors. I actually started back with Best Doctors in 2005, writing cases as an MD consultant, and continued with the organization until in 2010, I was brought on as the Associate Medical Director. I certainly could point to many cases where there have been dramatic changes in cancer diagnoses, people who were about to go for a bone marrow transplant, where it was recognized that the wrong disease was being treated and such a weighty intervention was not indicated. But one of the cases that really moved me the most was an older gentleman with a neurodegenerative disorder. It wasn't exactly clear what was going on, and he couldn't always be the primary person to participate in our interactions because he had difficulties with his cognition. When everything was gathered, the expert came back with a very powerful discussion about why and how this individual had Pick's disease. This was a diagnosis that had not been considered before, and it was a diagnosis for which the prognosis remained poor, and there was not any kind of silver bullet that would save this patient. But when I spoke with this patient's family and with this patient, it was such a moving experience because what everyone said is thank you for helping us to understand. Thank you for giving us answers. Thank you, even though you didn't give us hope, you gave us reassurance that there wasn't something that we were missing, that there wasn't some stone that was being left unturned. And that, again, is one of the most powerful parts of Best Doctors, is that there are times when we can give people silver bullets. There are times when we can dash in and make an amazing save. But even when we cannot, even when the condition does not allow for that, we can provide the kind of comfort, the kind of reassurance that comes in knowing that people have really listened, knowing that people have really looked, and knowing that people have really understood.